We often find Candida is not in isolation, but rather in combination with other infections. So if we find Candida just on the tongue, that's pretty rare. You're often going to see it test positive on both the organic acids test, and if it's bad enough, we'll see it on the stool test as well.
100%. No, I agree. So when we see gut stuff like this, like the Candida, we want to do some testing, right? Sometimes the stool testing may not be adequate enough to pick up Candida. So we'll look at clinical signs like the tongue. We may look at the fingernails or the toenails for that yellowing, kind of thickened, discolored nail. You may look at seborrheic dermatitis or that chronic dandruff on the hair, on the scalp. We may look at that Tinea versicolor, which is that kind of almost like lighter white spotting on the skin. That can be fungal in origin. Anything that's chronic Candida, chronic yeast infections for females, that higher pH in the vaginal tract, 5 or above, could be a sign of chronic Candida in the vaginal area as well. So these are all good signs that are, let's say athlete's foot as well, that itching between the toes. These are all good signs there could be a chronic yeast issue internally that we have to look at.